Each trimester is 13 weeks, so the first trimester is from not pregnant until you're 13 weeks. The first trimester, you're going to experience breast tenderness, and this is not everybody. Everybody's pregnancy experience is different, but common things that you can expect during the first trimester are breast tenderness and nausea and vomiting. The first trimester appointments consist of a lot of blood work. All your prenatal labs are drawn. Vaginal cultures are done to make sure you don't have any infections. A pap smear is done if you haven't had one in the past year. An ultrasound is done to confirm your pregnancy dates. We do the genetic testing in the first trimester. So in the first trimester, or in the entire pregnancy, if you're not an exercise person, being pregnant is not the time to start an exercise regimen. If exercise is a part of your regimen, you can continue that in pregnancy in the first trimester, providing the doctor doesn't say that you can't. You should avoid heavily processed lunch meats, and there's a whole list of fish that you should avoid. I can't think of them offhand, I always have to pull it up, but there's a bunch of fish with high levels of mercury that you should avoid during pregnancy. And you should avoid soft cheeses. I know it sounds weird, but not cream cheese. I mean the brie and the fromage, those kind of cheeses. If you're experiencing any vaginal bleeding, any at all, even if it's just a little spot when you wipe, and if you're having so much nausea and vomiting, you can't keep anything down and you're starting to feel weak from it. At the end of the first trimester, what has started to form is what's called the neural tube, and that will develop into the brain and the spinal cord. And then you start to develop ears and eyes at the end of the first trimester. The risk of miscarriage is highest during the first trimester because that's when the development occurs, and if the development doesn't occur correctly, then it invariably leads to miscarriage. Usually not until about 14 to 18 weeks where you begin to feel movement, and that's the second trimester. The second trimester is from about 13 and a half weeks until 26, 27 weeks, and each trimester lasts approximately 13 weeks. The second trimester, a lot of women feel great because the nausea and the vomiting resolves, and they're not so heavy that they're uncomfortable. So a lot of times the second trimester, you feel great. The second trimester is when you get an ultrasound to look at the complete anatomy of the baby, and a lot of times they'll tell you the sex of the baby then. And more testing. The testing spreads out in the second and third trimester, but there's still things to test for, and the main one in the second trimester is diabetes, a screening test to see if you're at risk for having diabetes associated with pregnancy. Throughout the pregnancy, you should avoid aspirin unless specifically told to take it by your physician. Definitely no ibuprofen, that's Motrin, Pamprin, Advil at all during pregnancy. If you sense a decrease in fetal movement, what I tell people is that the pregnancy, your baby is a person, and the person should move in there every now and then. If your husband didn't move for 12 hours, you wouldn't wait 12 hours to tell somebody. So it's just keep in mind that's a person, and they do people things. They sleep, they get the hiccups, they move around. At the end of the second trimester, everything is formed pretty well except the lungs are the last thing to form. The liver, the pancreas, the stomach. The end of the second trimester, you may even notice on the ultrasound the baby might suck his or her thumb. It can sometimes. Especially if baby's legs are crossed or baby's arms are over its lap, so to speak. I don't know about getting it wrong. Can it get it wrong? Absolutely. More likely, it's just not to be able to tell you what it is at all. Absolutely. You will feel the baby move beginning at about 16 weeks. You should start feeling the baby move. In the beginning, it may be difficult to tell if that's the baby moving or if it's your stomach growling. It's a little hard to tell. But as the pregnancy progresses, you'll definitely be able to tell a frank kick from just your stomach rumbling. The third trimester is from 27 weeks until you deliver, and again, it lasts about 13 weeks. The end of a pregnancy is considered at 40 weeks. During the third trimester, you can expect to become a little more uncomfortable because you're pretty heavy in the front. You may experience back pain because human beings are meant to stand up straight, but your center of gravity is off when you're pregnant, so it tends to pull you forward, so your back muscles tend to tighten up to hold you upright. So you may experience back pain, and you may start to experience cramping in the third trimester. The frequency of the appointments increase in the third trimester. So they go from about every 4 weeks in the first trimester to every 2 to 3 weeks in the second, and in the third trimester, they go from every 2 weeks to once a week. And those visits include a blood pressure check, a urine dip, a weight, listening to the baby's heartbeat. That's all the visits though. During the third trimester, you should avoid traveling too far from where you're going to deliver. So I don't like my patients, after about 28 to 32 weeks, I don't like for them to travel. You should call the doctor in the third trimester, again, if you perceive a decrease in fetal movement. If you're having watery discharge, so if you're concerned that your bag of water may have broken, vaginal bleeding. At the end of the third trimester, all the organs are formed. And again, the lungs are the last thing to form. A term pregnancy is considered 37 weeks. So after 37 weeks and beyond is safe. You should feel the baby move every hour. Cramping in the third trimester is normal, but if you are before 37 weeks and that cramping is associated with bleeding or more than 6 episodes in an hour or increased vaginal discharge, you should go to the hospital. Braxton Hicks are those early contractions, and again, nobody knows why they happen. Everybody doesn't get Braxton Hicks contractions, and they vary in intensity and frequency from person to person.
So they're pretty much the nutrients that are necessary to sustain your life at whatever stage of life you're at. It's just that in pregnancy, you might need a little bit more of them. And so certain minerals, though, that are important would be like iron and calcium. And then the B vitamins are important, specifically folate, or you might have heard it called folic acid. That's important not only in pregnancy, but also prior to pregnancy. It would be important to supplement with a folic acid supplement. Vitamin D is an important nutrient. Choline is important in pregnancy, and you can find that in eggs. So any of these are usually in a little bit higher amounts in a prenatal vitamin. So it's recommended that if you're planning conception, you should probably try to start taking a prenatal vitamin about a month before you conceive. For some women with histories of babies born with like neural tube defects, they should probably start one about 3 months before they become pregnant. So it's a pretty broad answer for a very broad question. But generally speaking, in your pregnancy, the calorie needs don't increase until the second and the third trimester. So the second trimester, you need about 350 extra calories above your pre-pregnancy needs, and the third trimester, about 450 calories more. And of course, we want you to fill those extra calories with nutrient-dense foods. So that would be things that are like lean proteins and nuts and seeds and whole grains and things that are going to give you lots of extra vitamins and minerals to support a healthy pregnancy. So the idea is, those are kind of two different answers. So the dates, a lot of people think that they're going to cause contractions. A lot of people will actually eat them in the third trimester to try to induce labor. There's really no strong evidence about that they do that one way or the other. So it's actually safe to eat dates in pregnancy. And they actually are full of fiber. They're a whole food source of carbohydrates. And so they might be a nice substitute for maybe sugary sweets that you're craving, actually. So again, no evidence against dates. It's kind of a myth. As far as the soft cheeses and soft cooked eggs and the deli meats, those recommendations are for a different reason. So those recommendations are so that you can avoid foodborne illness that might be in those foods. So those foodborne illnesses, if someone that's not pregnant gets the foodborne illness, they get sick, they get better, life goes on. But for a pregnant woman, if they get that foodborne illness, it can negatively affect the fetus as well. So usually that's why we say stay away from the unpasteurized dairy, soft cheeses, undercooked meat, undercooked eggs, and the lunch meat.